Welcome back. We are continuing our conversation with Dr. Bobby Mukkamala, the recently installed 180th president of the American Medical Association and a Flint physician, making Flint proud for sure.
Thank you.
Dr. Mukkamala, quite the journey between becoming president-elect and this week's installation and becoming the official president. You were faced with a pretty uncertain diagnosis last year. Talk to us about that diagnosis and the surgery that happened on December 13th.
Exactly, yeah, Friday the 13th, which I was a little freaked out about, but it all worked out great.
Here we are again, Friday the 13th.
Exactly, yep. But no, it was an amazing experience to go from just being on death's door with an 8-centimeter tumor right here, which is pretty big, to having a successful operation where 90% of it's removed. That last 10%, there's new treatment available to try to keep that small. Life expectancy is at least 10 years and could be double that. I went from the most miserable day of my life and my family's life to now every day I'm happy, right?
Yeah.
This is what I would consider sort of the bonus days. And I think it's amazing prep to be the president of the American Medical Association. Like somebody up there probably said, you're pretty ready being a doctor for 25 years and taking care of people in Flint, Michigan, but I'm going to push you a little harder. You're going to have this experience that's going to make you a better patient advocate.
Yeah.
And I think if that's what happened, it is totally correct.
And tell us about your recovery. You know, I noticed you came in today with
the
that very familiar look on your
Yeah, I didn't want to take it off because I didn't want to bleed on this beautiful chair.
So tell us, I'm sure that is a part of this recovery that you're undergoing right now. Tell us about your recovery.
Yeah, it's been, I mean, the brain thing biologically has been a challenge, but then just having my mind going through what it's like to be a patient after 25 years in practice, just navigating something, like getting my blood drawn today. Every time I go there for the past 6 months, there's always like a little pause, like, oh, we don't have this in the computer, or can you call this person? And luckily I have access. Like I can call my neurologist, I can call the Mayo Clinic, and immediately they'll send it over. But for a patient that doesn't have that kind of connection to the healthcare system, they're waiting for half an hour, maybe even days. And as a doctor, I would get their labs back eventually, not even realizing the hassle they went through to get this done. And now I know what kind of hassle that is. And it's amazing preparation just to try to improve healthcare. So I'm thankful.
Yeah, and as president of the AMA, are those kinds of experiences that you're now having, you can take back to your colleagues,
absolutely,
to fellow doctors, you know, who may not have this experience.
Yeah, definitely, it informs us as we make policy on what we want to pursue. But it's not that easy, right? I mean, a lot of these things are you know, private business, you know, or even nonprofit entities like insurance companies that sometimes make it a hassle with prior authorization, or government you know, rules and laws about what healthcare they have, or what you get with Medicare, what you get with Medicaid, which is a huge risk right now.
Right.
And so this information helps doctors, I think, make policy that protects our patients and improves healthcare in this country. So it's wonderful to have this as a knowledge point to improve the decisions we make.
Yeah, well, we are wishing you the best in your recovery and
Thank
that
you.
10-year life expectancy. We're claiming 20, 30, 40 years down.
I'm happy with whatever comes, and I love being in this community, so thank you.
The community loves what you do for the community as well. So finally, Dr. Bobby, tell us, you know, what does the future look like this year of the presidency at the AMA and then beyond? What are some of your hopes?
Yeah, so this year is about 200 days a year on the road. So last year as president-elect was about 100, and then this year is about 200 days a year on the road. Yep. So I go to the United Kingdom next weekend to represent us at the British Medical Association meeting. So that'll be a busy year, and then after that, I'm just looking forward to coming back home, not being as busy, and I'm planning on doing ENT work in the morning and then becoming a teacher also, because I think our school system has a lot of challenges, and I'm excited to teach kids.
Boy, some pretty lucky kids they'll be to have Dr. Bobby Mukkamala as their teacher.
Thank you.
Dr. Bobby, you've handled this whole thing with a lot of grace, and you are inspiration to so many. Thank you for coming in today, making Flint proud.
Thank you.
Your family proud, of course, and also the future of medicine is looking bright.
Thank you very much. It's been a wonderful opportunity.
Thank you for being here.
Absolutely.